Hello and welcome to the channel. In today's video I am sharing with you all one amazing technique that used to break the spasticity around the scapular muscles, pronator of forearms and shoulder muscles, and this exercise also helps to facilitate forearm supination and pronation and shoulder lateral and medial rotation movements. So let's start with the practical demonstration. So first step is to interlace both the hands in this manner so that elbow is in extended position and rest on the table. Now ask the patient to lean on the hemiplegic side in this manner while rotating the hemiplegic hand in supination and shoulder medial rotation with the help of normal hand. Now step 2 is to ask the patient to press the hemiplegic hand in downward direction in the supination and in the shoulder lateral rotation. Now the therapist has to notice if there is any tension in the hand or any stiffness in the hand. Once the stiffness is gone, the tension is released in supination and lateral rotation position of the muscles. Now the patient asks to shift the trunk in sideways manner like this and this, like this and this. So by performing trunk action, the therapist may inhibit the spasticity around the scapular muscles, the spasticity around the pronaters, the spasticity around the shoulder lateral flexor, because the proximal trunk is moving on the stable distal limbs. So what is the components and what are the steps? Let me brief you. First, you have to interlace your fingers. Now turn to the hemiplegic side. Ask the patient to push into supination and lateral flexion. Thumb is in the extension. Now while maintaining this position, once the tension release in the supinators and the lateral flexors, the patient has to shift the trunk in this manner while maintaining this position. So when the patient applies a downward pressure to the underneath hand, it will break the spasticity of supinators and lateral flexors. Once patient has done this exercise for at least 3 times, it will release the tension in the upper limb hand. Then you ask the patient to perform backward to the neutral position and to the supination, to the neutral position and to the forearm supination, to the neutral position and to the supination movements. Relax. So after performing this maneuver, you ask the patient to perform the supination activity for the normal hand with the assistance of the trunk and the hemiplegic hand. Again the supination of and forearms of hemiplegic hand with the assistance and help of normal hand. There is less chance of occurring any spasticity because the patient is performing exercise on a stable surface. So trunk shifting, supination, trunk shifting, supination, trunk shifting, supination. So by performing this activity in the acute phase, you may facilitate forearm supinator movement, shoulder lateral rotator movement and trunk rotation movement, and also inhibits any spasticity that occurs around the scapular region. So I hope the information that is shared in this video is beneficial for you. Stay connected with us and thank you.